Good afternoon, everyone. So welcome to the Children's, Seniors, Families Committee meeting and the Finance and Government Operations Committee. We just have to do that because of the two of us being on two committees together. And instead of roll call, Ignacio, can I just have everybody introduce themselves?
Good afternoon, Ignacio Guerrero, Director for the Department of Child Support Services.
Bob Minicucci, Social Services.
Good afternoon. Rob Coelho from County Counsel's Office.
Cindy Chavez, member of the Board of Supervisors.
Dave Cortese, Board of Supervisors.
John Mills for the County Executive's Office.
Great. We're going to now move to public comment. Do I have any members of the public who would like to speak to an item that is not on the agenda but within the purview of the committee? No? Yes?
I put a card in.
I apologize. Come on up, Susan. Oh, I see. Oh, I see. Welcome.
Thank you. 3 minutes? Thank you.
Yeah, and Susan, you can get right wherever you're most comfortable, but the mic's right in the...
Thank you. I appreciate it.
Yes.
You have some files, and Rob, you'll be interested in my files. They're all documents that I found in our court files. They're public records, and other than one which was related to private judging, which was a document that is intended to be public view, and I got that document from one of the people. The other one is a letter sent to me by Judge Lucas. You have all been listening to Scott Largent for years before I met Scott Largent. I met him on October 2, 2017. And Mr. Largent has been, Cindy, I met you the first time when you had just become elected, and I met you at a meeting for the Soroptimists. All the women I knew pulled behind you. They were thrilled a woman was running, and you were reaching out to us to help related to sex trafficking issues in our community with the Super Bowl coming. I have researched Scott's files, his parents' files, and he is a victim of domestic violence based on what's in the court file from his family files. He also had a principal at Saratoga High School who threw him under the bus as a kid. Didn't believe he needed a chance. And there was some connection between Los Gatos Little League and some retaliation with Los Gatos and Saratoga Little League. It is time for you to start listening. You still have nothing on your agenda. One of the files that I brought you is related to a mom from Saratoga. Her name was Kathy Fike. She lived next door to William Dancer and Catherine Gallagher. They had different last names, but they were judges, they were married, and they lived in our county. Judge Dancer was indicted for traffic court fixing. Catherine Gallagher is continuing to act in private judging cases in our county, and she's not complying with the law, and there is an appearance she is rigging our divorce cases, as are everyone who's working in private judging. I have found systemic issues that have harmed families. This morning, I looked up the divorce file of Bambi Larson. She was filed for divorce in 1995, and it was finished in 1997. One of the lawyers in her case is one that is now doing private judging, and he was the private judge in the Google divorce case. You guys have been letting this be quieted, and when someone tries to speak up and say something's not right in our courts, you attack them, you arrest them. Kathy Fike was prosecuted for taking $1 out of her account while her husband moved hundreds of thousands of dollars. Lynn Yates Carter and Judge Kane, who were responsible for referring her to the prosecutor and the taxpayers paying for her defense, prosecuted her on an order issued by a private judge that was never valid because Lucas did not properly appoint him. These are systemic issues that have happened since 2002. They're affecting our families, and it's time to pay attention.
Thank you, Susan. And I do have your packet here.
Thank you. That packet needs to be in the public record, and I will provide additional narrative on it later.
Thank you. We're going to move then to our consent calendar. And first, let me say, if something went on consent, it doesn't mean it's not working and that we're not excited about it. It just means that we've got the information we need from the report. What I would like to propose we put on consent is the item 4, the Senior Care Commission. They have a request to work with the City of San Jose's Care Commission, which sounds great. Item 6 is schooling services. And item 8, the extra help usage. Is there anybody here who would like to speak on any of those items? All right. We'll move the time to 2 minutes.
I have cards. I need to go get my notes in the back. I have cards for all those items.
Oh, for everything, okay. Go ahead. Yeah.
Hi, sorry, I don't have a card. I just want to thank you for this, for putting this on consent, and thank you for allowing us to co-sponsor an event with the San Jose Senior Citizens Commission in May for Older Adult Month. Thank you very much.
Gail, you should say your name for the record, though.
I'm sorry,
especially with no
Gail
card.
Osmer, Chair of the Santa Clara County Senior Care Commission.
Perfect,
Thank
thank you.
you.
And Susan, you're speaking under item 3.
Are you moving 6 to the consent calendar also?
Yes.
So are you giving me 2 minutes for each?
No, 2 minutes just for the consent calendar.
Then I'm going to speak on, first of all, I'm going to talk about on the consent calendar, but I am also going to speak on 6. And you can, at any time, pick these issues up and move them to your consent calendar. You can, at any time, agendize things. We have been coming in here for 2 years. Scott's been coming in here longer. Issues affecting our seniors are highly applicable in our courts. What's happening in our probate courts, the way that seniors' homes are being taken, the issues that they're having in dealing with their financial issues into retirement, and how they struggle to take care of their families and their children, and how they want to have something left, has to be addressed. We are ignoring the courts, and you're saying you have no jurisdiction over it when you know that's a lie. I have heard too many seniors either getting fleeced by scam artists, which the district attorney does nothing about, or seniors not able to make it in their homes, and we have resources that can help them, but they're so afraid to reach out to you because they're afraid that what will happen is a rogue county employee will decide to put them into conservatorship, and that is happening to too many of our loved ones and our seniors and our parents. We need to be neighborly, we need to not make this litigious, and we need to be helping our seniors. Mr. Berg just recently had surgery, and his last email sent on his way out for surgery was to Mr. Rosen, because he knows that Mr. Rosen let him down. Mr. Rosen prosecuted for politics. Can you imagine if you were going into surgery at 80 years old and did not know if you were going to make it out of that surgery? And thankfully he did. But your last thought was to send one more email to the district attorney, because the district attorney has failed to prosecute the people who have been stealing from seniors, has failed to prosecute people that he knows he should prosecute, because he only prosecutes crimes that are going to get him reelected. He is misusing his office and all of the people working for him. You have to recognize that until you do something about our district attorney and our victim services office, our children, our seniors, and our moms that are 50 and up that are trying to make it are going to be let down.
Thank you, Susan. On the so that's on our consent calendar. Let me just say that's item 4, 6, and 8. And we have a motion from Supervisor Cortese and a second from me to put those on consent and to move those on to the board. So thank you, everyone. What I'm going to ask for the other items before us, we're going to move now to item 5, and this is Adult Protective Services. And I'm going to ask that the staff, as all the staff are preparing for their comments today, that really, if you can, if you don't have slides, I'm going to ask people to be really brief, just because slides I think really help focus us. And if you do have slides, I'm just going to say thank you, because I think that's an easier way to follow some of these items. All right, welcome, Jim. And have everybody introduce themselves.
Good afternoon. Thank you, Supervisor Chavez. Jim Ramoni with the Department of Aging and Adult Services. We are here to present our 2018 Adult Protective Services Annual Report. I'm joined by our 2 program managers, Marta Jaquez and Valerie Smith. And I would just like to highlight and thank again the board for the support this current fiscal year. The Adult Protective Services program was augmented in 2019 fiscal year with an additional 8 social work positions and 2 supervisory positions that have helped our workload dramatically. So we're very grateful for that. What Valerie and Marta have prepared with this report is an overview of our accomplishments during this past year and some of the challenges challenges we're still addressing, but we have prepared 3 slides
Great.
for overview, and we'll highlight those now. So I'll turn it over to Valerie. Thank you.
Thank you.
Is it on, Valerie? I'm sorry, Marta. Go ahead.
It's okay. Good afternoon. I'm Martha Hawkes. Thank you very much for your time this afternoon. So the first slide actually profiles 3 items that we wanted to highlight because we have really sought to upgrade the tools that we're using in an effort to better integrate evidence-based practice at APS. And so we're profiling these 3 items. The very first is our new case management program, ACE, which we developed in collaboration with Social Services TSS program. And we developed this in-house, and development in-house really allowed us to be able to research and incorporate best practices in APS with our assessments, with our service plans, and with investigations. It really also allowed us to engage our staff to allow them to give us their input and their ideas, and to improve overall organization, and to allow for increased consistency in terms of documentation and data entry. And it allowed for more information gathering about who we serve, what services we provide, and how we're impacting the clients that we serve in the community. The second item that we're highlighting is our structured decision-making tools. So we developed during 2017-18, and we added 2 structured decision-making tools that were designed by the National Council on Crime and Delinquency, specifically for APS. And these were implemented in the fall of 2018 and have been fully integrated into our ACE program, our case management program. These structured decision-making tools are evidence-based, they're research-based, and they identify the key points through the different stages of the APS case. The 2 tools that were implemented were the intake tool that is used at the time that an abuse report is taken, and the safety tool, which is used at the time the first APS visit occurs, and is to assure that immediate safety needs are evaluated in a consistent manner by all social workers. Lastly, we're highlighting the National Data Reporting System, which in 2014, the Administration for Community Living funded the development of the National Adult Maltreatment Reporting System, known as NAMRS. It is the first comprehensive national reporting system for adult protective services. And so throughout the state, APS programs are actually very excited about this because it will allow APS programs across the country to finally gather data and demonstrate the need for funding and services nationwide, and policy in addition to that. In 2016, the California Department of Social Services was awarded a grant to work in conjunction with the California Welfare Directors Association and subcommittee, the Protective Services Operations Committee, PSOC, to revise our California Monthly Statistical Report form that collects the components, the main data that the state uses and collects from each and every county. And we collaborated again with TSS to integrate the new data points into ACE, into our new system. And we're really proud that we're in compliance and have made all the state deadlines and went live in February of this year, having integrated all the new data points. Thank you.
Thank you, supervisors, for hearing us today. The other challenges we want to highlight for APS and many of the DOS programs are the population growth and housing instability. So with population growth, we're talking about the aging population in particular, and we've been feeling the impact of this growth of the population for several years now. County services provide the safety net for the most vulnerable in our community. Our staff have to address issues that the APS program was not designed to address, such as lack of affordable transportation services, housing instability, affordable health care that includes affordable medication, affordable in-home care for middle-income earners that do not qualify for Medi-Cal or have too high share of cost, and food insecurity. These are just a few items that all of the DOS programs and APS certainly are impacted by the lack of community services available to meet these needs. As the county leaders tasked to review how county resources are used, we urge you to prioritize this population and their needs, to plan for them, to fund these programs, and to address these issues. Older adults, and we're talking about adults age 65 and older, will represent a quarter of the population in this county by 2046. The second point I wanted to make was about housing instability. Several state agencies and a coalition co-sponsored a budget proposal, a state budget proposal, to fund the Home Safe Demonstration Pilot Grant. And this was supported by Assemblymember Ash Kalra, who's the chair of the Assembly Committee on Aging and Long-Term Care, as the legislative champion. In the fall of 2018, Santa Clara County APS responded to the Home Safe RFP, and our proposal was approved and funded. This grant will allow APS to provide prevention services and supports to stabilize APS clients at risk for eviction and/or homelessness, and those who have recently become homeless due to self-neglect or other types of abuse in APS. This is the first time there's a specific program created to address APS, and we're very proud to have been awarded the grant. However, there are limitations to the grant. It is a 3-year grant. We actually only have 2 years to provide the services, and we'll be limited to only serving 120 clients during those 2 years. And we anticipate going live July 1st, 2019.
Our last slide, we'd like to highlight some of the public education and outreach efforts that we've done this past year. Elder abuse is a public health issue. According to the Administration on Community Living, survivors of abuse have higher rates of depression, they have increased rates of hospitalization, as well as increased rates of institutionalization, and victims are 3 times more likely to die prematurely. The time is now to focus on public awareness, prevention, early intervention, and collaborative practices to create new opportunities and approaches to the concepts of aging in place. The Department of Aging and Adult Services APS program was proud to sponsor its 4th annual World Elder Abuse Awareness Day, or WEAD event, last June at the San Jose City Hall. Our WEAD was the original WEAD was launched on June 15, 2006 by the International Network for the Prevention of Elder Abuse and World Health Organization at the United Nations as an opportunity for communities around the world to promote a better understanding of abuse and neglect of older persons by raising awareness of the cultural, social, economic, and demographic processes affecting elder abuse and neglect. We're proud to announce that we will be having our 5th annual WEAD event this coming June. The 15th falls on a Saturday, so we'll be hosting it on June 13th, but we'll be inviting all of your offices to attend our event. And thank you, Supervisor Cortese, for your participation at last year's event. That's the conclusion of our presentation. We'd like to open it up for any questions you may have.
Great. So hang tight. What we're going to do is we're going to go to Susan, and then we'll go to the committee for questions.
So one of the problems we have is that when we have people like Jim Ramone come here and make statements to you, he leaves a lot of information out. Either he thinks we're dumb and we can't take it, or he's left it out on purpose. But his office is ranked one of the worst in the state when compared to other offices. To give you 2 examples of how these systems are failing and the communications are not in place and we're wasting tremendous taxpayer money and letting seniors down, I want to give you 2 examples. The first one is of a 70-year-old man who was married to a younger woman, and she was abusive to him, got physical with him, and he called 911. The district attorney prosecuted her, and like most victims, he got the district attorney to drop the charges. That file is completely gone from the criminal courts. She hired the best lawyer to scrub it, and he scrubbed it. Can't get those records, can't find it. Later, she claimed domestic violence, and she was found to have been a liar in 3 different courts, criminal, civil, and family. But that is an issue. Second case is Judge Stuart Scott sent his bailiffs down to the grandmother's house of a young man who had tried to file a judge complaint against him. His mother had tried to get a DV against her. Her name's Ginger. She lives in Los Gatos. She decided she couldn't parent anymore, and instead of dealing with it herself, she used our courts, the way the courts had been used against her. That young man had been caring for his grandmother for years and years and years. And when he reached out to Adult Protective Services because his aunts were engaging in predatory conduct that medical people and mandatory reporters had seen and not reported, he tried to report it. It was reported, and I was present, to the Santa Clara County Police Department, and they did nothing. So you can go out and you can educate the world, but right here in your own backyard, with the money that taxpayers pay you to protect our seniors, you're failing. And you're failing with the departments that you're in charge of. That would include the police.
Here, first of all, I wanted to say that I think we're moving in a really great direction. This is, I think, very exciting. So let me just start there. I want to recommend on this item that we are looking, I know that we're looking at doing a fall retreat or public hearing around senior services. And one of the issues that's a little hard to rectify is just recognizing how much of the population will become seniors in every day. We have more and more of us that are falling into one category or another. And some time ago, and Bob, I don't know if you remember that we used to have an Office of Advanced Planning. This was a long time ago, and it was headed by, oh my goodness, he's a really bright guy. And he's the one who did the silver tsunami, like he did some of the projections of where we were going to be with our senior population. And I just wanted to recommend that when we do that retreat, that we start off with a really intensive look at the demographics of that body of work. And I don't know if I don't hope we shouldn't need to do a referral on this, but I do think that the demographics of what we see happening here is just something we want to be able to put on one sheet, because I think we want to be able to share it with the world, because a lot of with the exception, I would say, of Dave, I think that everybody's busy focused on their other areas. And to me, this is like the boiling water. Like, it's just people aren't going to see it till it's just at catastrophic levels. So anyway, does that make sense as like an infographic?
I was going to say there are plenty of infographics.
Oh, great.
AARP, a lot of federal and agencies, but in a lot of our senior agenda reports that we've issued over the last few years, we also highlight those.
That would be great.
So that'd be very easy to
Perfect.
pull that information
And
together.
when we work on the on that day, I would really like to better understand how this office connects to work that the district attorney's doing, because I will also say that what's a little bit confusing to me, and I think to the public, is just how all of our services do or don't link. Right. And they may not link, and that's okay, because if they don't, that's just something we identify as a gap in service and figure out how to do it. So it's not like, the way I'm looking at this day isn't to say, you're doing something right and we're doing it wrong. I think we're going to be constantly becoming, particularly in this area, because it's really new for us to be thinking about. So anyway, is that okay? That makes sense?
Yes.
Okay. And then just one other point I wanted to raise to both Bob and Deborah. One of the other things as we think about the work relative to prevention is there's a lot of work being done now around health issues. So as people get older, we have less people that are going to be chronically ill, because the one big challenge we have is just chronic illnesses like diabetes, then seniors, and the convergence of those kinds of issues are can be overwhelming. But I don't know if, as we think about prevention, if we can ask our public health partners to kind of help us understand better that particular topic relative to seniors, because I think we've been focused on it relative to youth.
Yeah, no, I agree. And we've discussed that, and that is kind of on our radar in part of the framework.
And by the way, if we can't dig into it when we're talking prevention the first round, let's add it to the hearing, because we'll need to dig into it anyway. Good. All right. Dave, you have any comments?
Just one basic question. On the slide 5B or packet page 31, it's just a slide that shows population growth. I think I've been using slightly higher numbers based on some previous projections probably that we've used in the past around the growth of some of the needs in our systems, as in population would double over 15 years. And I think we started using that kind of a mantra out in the community. At least I was pulling it from somewhere back at that time, you know, based on some county data. And when I say back at that time, I want to say 2015, because I remember the idea being that by 2030, we had to be concerned about a population that might be 27, 28%. We were at about 15% back then. Are these numbers contradictory to that, or are these just sort of revised projections? When I say, I don't mean contradictory, but are these revised projections, or are they just, am I comparing apples to oranges? Or do you want to, you can dismiss my recollection. You can just say we never had numbers like that, because it's possible I lifted them from ABAG or, you know, some other trend projections in the Bay Area.
So I think statistics for the aging population vary because it's how people are defining aging or older adult. In this particular case, we were looking at adults age 65 and older because that's how the state legislature defined an elder for APS purposes. But in other reports, people might consider people 60 and over or 55 and over, so or 62 and over. So it really varies. You have to know the age that's being measured. And this was part of an off-agenda referral that Cindy had asked for. I can't remember the year. It was within the last 3 years that the Office of Cultural Competency ran these numbers for us and did some demographic projections, and that's where these numbers have come from.
It would be great if you could give us, in due course, we don't need this tomorrow, but all the Board of Supervisors offices, those breaks, the projections that you would currently rely upon at 55, 60, 65, wherever they come from in terms of authority. I would want them from you. I know we could have our staffs research that, but if they come from you, then it makes me feel like we're all on the same page in terms of speaking points, because to the earlier comments, I think we want to keep elevating, even in our own offices, that kind of information, given the interface that we have with the community, so that when folks are out, wherever they are, you know, it doesn't matter if you're speaking to young people, middle-aged people, old people, everyone needs to hear this message that there's going to be a cost of doing business, I think, you know, going forward, based on some pretty dramatic increase. So I don't know if you could provide that and just kind of make it.
I can certainly have that information pulled together. I think it's worthy to note, we always rely on census data, and of course, you know, as we're approaching the new census in the coming year, I think that, you know, we will once again want to revise data based on whatever the new census information reveals as well. So yeah,
constant revisions are probably a good thing. And as I noted, there's certainly data all over the place that other people are using in their forecasts, especially the planning agencies in the region. I know we see those a lot there, but I'm not looking for perfection here. I'm just looking to get us, you know, I think you made a great point about the fact that we're now defining an older adult population. You know, I think many of us, I'll speak for myself, have experienced that since age 55 or earlier. They're starting to get the mailers in the mail. From whomever, AARP or whatever, but instead of fighting that, just saying, okay, well, what does that population look like, you know, going forward? I realize somebody's doing kind of an actuarial analysis of that, and that's the other variable, right? Someone can sit here and say, what happened? Are we all dying sooner? Are we living longer? But anyway, if you can just give us a cheat sheet. I think it would be very helpful. At least I speak for my office, because we're constantly putting those numbers, those kind of projections out as backdrop for a larger conversation with the community. Thank you.
Thank you.
Thank you very much.
Thank you.
So we're going to move on then to item 7. This is contracts and procurement. George, welcome.
Good afternoon. My name is George Montes. I am from the Social Services Agency, Office of Contracts Management, reporting on the overview of the contract operations and procurement processes. A little bit of background information. The Social Services Agency Office of Contracts Summary Report is presented at the request of Supervisor Chavez. We present on a regular basis every 6 months. The intent behind the report is to provide an overview of the processes from the Social Services Agency as it relates to OCM strategic initiatives. As of this report, the Social Services Agency has 394 active contracts that total $147 million in dollar value. Not all contracts are paid by county general funds. We do have a complex funding process, and there's a variety of funding streams that make up the $147 million. If you recall, I've been with the office for about maybe 4 years now, and we've started with a strategic initiative to transform the operations into a more standardized process to reflect best practices related procurement. As of March 2019, as I stated, there's 394 contracts. They incorporate $174,000 in COLA adjustments that were approved by the CEO for FY19 contracts. Those were applied to 31 contracts. 6 inventory items and 9 board referrals were also activated for a total of $1,500,000 in services. In terms of staff development, we continue to progress our internal infrastructure into applying best practices. This is done in collaboration with the Office of Countywide Contracting and also with the Procurement Department. And it incorporates best practice standards that leadership has brought to the county to also apply it to our infrastructure and processes. One of the areas where we've addressed in the past is we wanted to create a little bit more internal controls as it relates to payments, invoicing processing, and budget approvals. And through those efforts, we've activated procedures to apply internal controls that have shown improvement of 50% of payment processes for the CBOs and our vendors.
That's great.
Also, as it relates to performance outcomes, if you recall, back in the days, we did start the initiative of our structured logic model of performance measures. Those performance measures incorporate the resources that go into a vendor, the short-term outcomes, the medium-term outcomes, and long-term outcomes. As of this report, we've adopted those dashboards to 32% of our portfolio of services. These are attached to the report for your review as well. Part of those reports is really to activate a CQI process where we have feedback mechanisms going back and forth from the vendors to the office for improvement opportunities and to also promote transparency. In terms of community engagement, this fiscal year we activated our on-site monitoring standards. The on-site monitoring standards is an activation of a team that goes from the county to the vendors to review their operations to make sure they are in compliance with the contract expectations. The intent behind that process is really to promote another CQI opportunity and offer technical support to vendors that might be needing some support from the office. And in terms of procurement policies, we continue to work very closely with the Office of Countywide Contracting, with Procurement Department, to also give feedback in the Procurement Liaison Collaborative to help inform the county's procurement practices and continue to move us towards best practices. There's a lot of opportunities for improvement. What we've started is just the start of something that will evolve over time and continue to improve as we learn more. In terms of our next steps, we'll continue to empower our staff, our vendors to learn, adopt, and practice procurement best practices. Something that is of relevance for us in the near future is to activate a technology solution to improve transparency, spend visibility, performance measures, and accountable contract processes. We did have a very busy year this year in terms of competitive solicitations. We did release up to 30 RFPs this fiscal year. We are very busy, and with the goal to activate both performance measures and activate services in time by July 1, 2019. Of relevance for us and importance, all this foundational work is very important to continue to promote the CQI process, feedback mechanisms, and to really get together with the community to help us shape and improve our operations and service delivery to our community. Ultimately, we want to continue to serve, empower, and transform. And this is our presentation.
So we have one speaker from the public, so I'll let, and Susan, it's blank, but I'm assuming this is you? Okay. And then we'll make some comments or questions.
Thank you. I was actually going to give you a pass and not talk on this one, but then I remembered I work with a number of our local high schools, Palo Alto, Los Altos, Los Gatos, and my friends down in Gilroy. I will work with any school, state, college, public agency. I will even work with private schools as long as I'm sure they're not cheating. So in that vein, I want to help translate this to what we call in the media open sourcing. And when students hear a report like this, I'm going to give you some ideas on how you fact check your politicians. The first thing is they said there was a number of $147 million. Where did that come from? And how is that money being spent? It is the job of the county government to spend taxpayer money properly. When county employees do not do that, it's called improper governmental activity, and it's a crime. There was a comment about contracts back and forth, and I've been doing a lot of work on this related to the building of our new family courthouse. The contracts back and forth can conceal secret deals, emoluments, and other things where contractors can be getting kickbacks. They can be using contract workers who are undocumented workers, money laundering, and other things. So that's important to look at. There was also a comment about vendor review. Look at the vendors that they're hiring and then check them. Go, if they're contracting with a nursing home, go by and see what kind of care people are getting in that nursing home. Don't just work off the numbers. Nonprofits for seniors and children. We have a lot of good nonprofits here that are doing a lot of work, but they're not getting the county money. Look to the vendors who are. Look, is that a political kickback or is that a problem? And then also finally, I want to define the difference between a competitive bid and a non-competitive bid. When there are bids and grants used, there is a strong dependence on compliance. If there is a non-compliance, they could be a non-compliance of state and federal funds, and that's a crime. Thank you.
Thank you. So a couple things I just wanted to say. First of all, I really appreciate how much work you're doing and how we're going in such a great direction. And I really just want to highlight how exciting it is to think about having, and I know this is a countywide kind of vision, is being able to know all the contracts we have with very specific entities. I think that if I were to think of the one thing that would save us money and time, it would be to better understand what single contractor is getting across county, what we're paying them to do, how we're leveraging that money, and all of, and that could be for nonprofits, for-profits, just all of them. So I think your vision around how you participate as part of the county's family of contract managers is really very exciting, and I'm really looking forward to seeing it. And then the last thing I just wanted to say is that I do recognize that a big body of work that, again, is happening countywide that really puts a lot of pressure on our contracts and our folks who are managing contracts is how we're starting to visualize and better understand our partnerships with our nonprofit community and how we can get to moving to a more, outcome-based contract and having a different kind of partnership. And one of the reasons I've been so excited about SSA, honestly, is I think because of the mechanisms you're using already to engage with your nonprofit partners, that you're an agency that we can really start to do new things, new creative mechanisms that protect our commonwealth, our resources, get better outcomes for our clients, and improve and have more meaningful partnerships, really allowing us to say, well, if this isn't working, can we try X, Y, or Z, because the partnership is so strong and because we trust that, not just trust, but we can verify that their back of house is strong, like the way ours is. So anyway, I'm looking forward to seeing how how the base work you've done here gets us into even more transformative work. So thank you. I just wanted to say thanks. Dave, if nothing else, then you got out of here. Lucky you. All right. We're going to move on to the rake. This is item 9. And let me just look at my notes to see who is presenting on this item. Welcome. And if you just want to introduce yourself.
Hi, I'm Cheryl Thomas Washburn, and I'm a Social Services Program Manager over the rake and placement. I'm presenting this report in place of Francesca Laguru, as she is at a conference out of town. Thank you for the opportunity to present this report on the rake to the CSFC. That includes our response to the JJC's December interim report recommendations. Oh, got it. The agency is in the process of submitting the essential terms of agreement to the Board of Supervisors for signature. The item is scheduled to be presented on April 9th. Once this is approved, the agreement will be submitted to the CDSS for signature. Once all the signatures are completed, CDSS will provide the rake with provisional licensure as a 5-day shelter for the first year, a 4-day shelter for the second year, and a 3-day shelter for the third year. After the third year, there will be a reevaluation of the need for a licensure. The rake has hired a Social Services Program Manager 1, Nathan Lingett Thomas. He is a licensed clinical social worker and brings over 15 years of experience advocating for and working with youth in foster care. Mr. Lingett Thomas began with the rake on 3/11/19 and will provide on-site leadership, consultation, direction, guidance, and mentoring to staff in addition to facility oversight. The department is also looking to fill a vacant Social Worker 1 position, and in the meantime, we've created a pool of extra help Social Worker 1s to assist with overtime as needed. In regards to training, in 2017, the rake began using the therapeutic critical intervention model, which is for staff who care for children and youth and focuses on critical intervention and prevention. The model is designed to support staff to utilize constructive ways to manage crisis with the goal of preventing it and reducing the potential injury to youth or staff. All rake staff have been trained on this model and are preparing for recertification aimed at maintaining skill level. In addition, the agency's staff development ensures that new hires to the rake are trained within the first 6 weeks. The department is working to reduce the number of times that the sheriff's office is called for interventions. We have seen a decrease in calls to the sheriff's office from August 2018 to current. From August to October, the sheriffs were called for assistance 11 times. From November 2018 to February 2019, the sheriff's office was called 3 times. If after 3 additional months the data holds true, the department will build upon TCI and will collaborate with the probation department to develop additional training for staff. Currently, probation is reviewing the therapeutic critical intervention curriculum with the future intent to design curricula for support of the rake while incorporating those practices. In line with this, the department is having discussions to utilize existing services and exploring additional funding and supports to reduce the frequency of involvement of law enforcement at the rake. This is in line with the goal of AB 1811. The department is exploring other resources to meet this goal. One of the ways the rake is using existing services is to access the support of placement services and crisis stabilization response team through Uplift. 14 rake youth were referred to this service for support between November 2018 and February 2019. The rake continues to collaborate with behavioral health services and the Spark Clinic to meet the physical and emotional needs of children. Further, the rake also collaborates with internal supports such as the Transformation Team for youth impacted by CSEC to meet the needs of the youth. The department continues to seek ways to leverage current resources and new resources to increase the safety and well-being of youth and children at the rake. I'm sorry. What's happening? Okay.
It's not cooperating with
Not
you. I know you have. I know you have
cooperating, and that is
We have your
okay.
slides. Ah, there you go. Thank you.
So it was the button pusher. So we'll now look at and respond to the recommendations by the JJC. The department continues to work with the JJC to ensure the needs of children and youth are met while they are at the rake. The JJC recommends that the planning and decision-making for the location of the rake and the co-location of services be transparent and include input from stakeholders. The department director, Francesca LaRue, or designee attends the JJC and Child Abuse Prevention Council meetings regularly, sharing updates as they become available. Additionally, the JJC visits the rake on a regular basis. When information becomes available, the department shares what it can with the JJC and stakeholders. The department appreciates the care and investment that JJC has in supporting children and youth at the rake. The second JJC recommendation is a request that they be informed of the ongoing process of licensing and remodeling of the Enborg facility. As indicated earlier in this presentation, the department is scheduled to submit the essential terms agreement of the General Operation Guidelines to the board for signature on April 9th. As for the remodeling of the Enborg facility, a decision has not yet been reached about the purchase of 2300 Enborg. The current lease has been extended until May 2019. Until then, no renovations can take place. Central Services is supporting the process and keeps agency leadership updated as to the progress. In the meantime, the Assessment and Intake Center staff are in the process of moving from 2300 Enborg to 373 West Julian Street. This will open up additional space at the rake for the receiving center staff and youth. The third recommendation of the JJC is that the Policies and Procedures Manual be put into practice and made accessible online. The rake is currently using the Policies and Procedures Manual, but they continue to be in draft form until CCL licensure is received. A hard copy of that manual is placed in 3 locations: the supervisor's office, the staff computer room, and the front administrative area for ease of access. In addition, with the support of the agency's Technology Services and Solutions team, the Policy and Procedures Manual is available on the KIDS database. The department is also evaluating adding these online to our operational policies and procedures site. The rake staff will also be receiving an initial overview training on the manual between now and the next CSFC meeting, next CSFC quarterly report in May. And prioritized topics include food safety, client rights, and medical assessments and prescription management. We're also working with staff development to build comprehensive training for the policies and procedures. The fourth recommendation is to reduce the number of incidents regarding access to food in the kitchen. At this time, snacks and fruit are left out for youth to access 24 hours a day. When youth are brought to the rake during late or early hours, staff provide food for them. In addition, in partnership with VMC's food service, the rake has moved from utilizing a 1-week patient menu to using a 4-week cafeteria menu, which offers a greater variety of choices of food and less repeated meals. The meals will also be child and youth friendly. Prioritized steps for the rake are to train and familiarize the new Social Services Program Manager 1 to the rake, to continue to collaborate with probation and staff development to develop and execute supportive training for staff to benefit children and youth, and to continue ongoing attendance to the CSFC, the JJC, and the CAPC meetings to share information as it becomes available on status and location of the rake. I can now address any questions the committee may have. Thank you.
So I'm going to ask the public speakers to come forward, and I think Susan is your Silicon Valley mom, and Penelope after that. Thank you.
So I just want to make a personal comment, and that is, as a middle-aged mom, I was always taught that we want to do the polite thing and we want to use language that makes everyone feel good. And Cindy, when you say we're doing really well and we're moving in a good direction, that's a little misleading. There is a huge disconnect between what children and seniors are experiencing in our community. And I think when I look at this report and I'm looking at how you're capturing numbers and everything else, the best way to describe it is what just happened to me this weekend when I tried to help the father of Audrey Potts, who was being cyberbullied and his children being threatened online with Facebook. I reached out to the Facebook lawyers, I reached out to Facebook Press, and I reached out to the Sunnyvale Police Department where they work. I spoke with the desk sergeant, and they told me that he had to go and file his complaint in the family court. This man has been through hell and back in our family court and in our community that has ignored him. And I thought to myself for a minute, imagine if Audrey Pott post that party and being distraught over sexual abuse and cyberbullying that she had experienced. Her parents were divorced. She didn't have anyone to talk to. They were in a bitter custody battle. They'd put a price tag on her head. She was very depressed. Imagine if Audrey Pott had called the local police department and said, I'm really getting abused online. It's making me depressed. I'm seriously thinking of hurting myself and I need help. And that desk sergeant would have said to her, go to the family court on Monday morning. Monday morning might have been too late. You're not capturing the numbers, you're sending them to family court as an informal policy, and there the records are not kept, people are being underserved, and our kids and our seniors are in crisis because of your policies and practices. Thank you.
Thank you, Susan.
Good afternoon. I'm Penny Blake, as you know me, and I'm the author of the report because I'm the chair of the Juvenile Justice's Rate Committee. So I want to start by saying, as we frequently have, but to thank again the staff at the rake and in the Department of Family and Children's Services for their ongoing cooperation, and to emphasize that any issues that we do have with how the rake is run or its programming is not reflective of their dedication to serving children. The staff also has attempted to be very open and candid with us. However, in our first recommendation, our concern there was that they simply didn't have the information to share with stakeholders about what was happening with the location and the ongoing programming there. We're reaching the end of the present lease again, and we don't have any information about the future. As long as children are at the facility on a day-to-day basis, we can't make improvements that are necessary to adequately care for them while we don't know what's going to happen. Because of that, we would request the planning on reconfiguration of the present facility begin now, even though we don't have a lease. You know, the presentation indicated that, well, we don't know yet, so we can't plan. Well, we would ask that planning begin, that stakeholders be included in it, so that as soon as we do know, we can get started right away. As to the policies and procedures manual, again, we want to say that we have seen a real decrease. It was reported to you today. We have seen the decrease in the number of incidents that are taking place out at the rake. However, I'm sorry.
Just finish that thought.
Okay.
Please.
In discussing with staff the use of the policies and procedures manual, it's still just is not uniformly there. The policies and procedures manual is a well thought out, well written document. So we would urge that it be put into use and be trained on just really as soon as possible.
So your time is up. What I'm going to ask you to do, if you can sit over here, I'm going to just make a couple comments, and then and just because you authored one of the reports, we probably should have had you here anyway. That was my mistake. So thank you. Here's what I would like to recommend. I'm going to look to you because I think this is in the county exec's hands. I do not want to make a recommendation today about tenant improvements or any of those things because I know you're in a negotiation process, and so I want to just be respectful of that process. That being said, what I'm going to ask is to have the full report come to the board in April, because if we're not done negotiating in April, then we have a whole different set of issues. At that time, I would just like to ask that this report be incorporated just in its entirety to the board. But what I'm going to request is that we come with some additional questions being answered. And let me just outline sort of the major areas that I am interested in. One is that I know we're working with a nonprofit partner, and I apologize. The reason I'm looking to him is that when it has a budget implication, I'm looking to the office that makes those recommendations. So I apologize, not to be disrespectful. But a couple things. One is that I do want to make sure that a bigger question, that there's two questions. There's one, what happens to the rake in the short run? There's two, what happens to the rake in the long run? And so during budget, I want to encourage, as part of the discussion around the capital budget, the prioritization of what's in the pipeline. They did that for us recently, John, but my guess is that some of that will change as we go through this process of purchasing the hospitals. Our timelines may look a little different. I just think we need to be able to share that with the board in terms of what the implications of that are. That's one. Two, that the role of family finding and when we anticipate that to be at maximum capacity, so we better understand what the actual numbers at the rake will be in the long term, because that's actually a pretty significant policy change. And three, and this was actually touched upon, as we struggle to better understand how to use the new state policies for CCR in general, one of the areas that we've been really thinking about for young people that are hard to serve or have a high need is looking more at professional homes for children who are going to be high need and influx for some period of time. And one of the challenges we have there is that we are investing I forgot what the amount is, but let's say it's $2,500 a month, where we may have one or two children that require only one adult in the house to work, which means that the economics of having these homes is pretty small. So I also want to make sure we have a report back on what we're currently funding those at, how many we have, what we think we're going to get to in terms of the total number of those homes, because all of that is tied into the health of this system. And I know that under the leadership, and Penny, your group both has a concern about the rate, but you've been pushing us to look at these other two ends anyway. Yes. So if we're looking at the ingress and we're looking at the options for kids who are hard to serve, I think that's going to be really critical. In fact, some of the issues that are being raised around the challenges on site are really having to do with, I think, both, I think in a very meaningful way, kind of training, but also that we're having I think we're seeing an emerging trend with higher mental health needs, and our whole system, every system's got to figure out how to respond to it, but I don't think there's any place that's probably more pronounced than perhaps here and at the ranch, maybe juvenile hall. Does that make sense to everyone? Okay. So, and then the obvious one is, like I said, that May question is kind of the first question. Okay. All right. So if any comments or questions on what I've asked of you all? No? Penny, you're okay? All right. All right. With that, we'll just, Bob, I'm sorry. I didn't see your light.
So we can do that, and just to respond to kind of the professional, settings and such. We'll report back on that, but just to sort of set the expectations on it is that the state recently recognized that this has been a pain point for the entire state, and that it is essentially not gotten off the ground. We as a county were singled out as being very successful because we have one or two of these. So it's still very much a work in progress, and we will definitely report back, but just to set the expectations of there's a lot of work ahead for this particular piece.
One thing I would say, I would use this as an opportunity very, very briefly just to help the board understand what the delta is in terms of service options. Because I think that, I think because we're on this committee and we get these reports, we have a different sense about it. But I think the state was not just optimistic, but I don't even know how to describe it. So anyway, we'll just leave it there. All right. Well, thank you, everyone, and thanks very much. And tell Francesca, thank you for sending us you. I appreciate it. All right. So, Dave, are you comfortable with that direction? Yes. Okay. So we'll make that a motion in a second, just because we added some direction to the board. I mean, for this item.
That's agreed.
Great. Thank you. So that passes, and we're going to move on to item 10, and this is timely dental and medical. Welcome. Jackie, can you make sure that's on?
Is it on now?
Perfect. Thank you.
Good afternoon. I'm Jackie Howe with the Department of Family and Children's Services. I'm here to talk with you about, to actually give you an update that was requested in December. In December 2018, we came to the Board of Supervisors with some updates related to timely dental. And the board asked us to report back on 5 items that we divided into basically 3 topics: authority to consent, medical and dental information, and continuity of care. The referral was made to the Department of Family and Children's Services and County Council, and we have County Council here to start off our discussion with authority to consent.
Good afternoon. I'm Elizabeth Morgan. I'm a lead deputy county counsel in the Child Dependency Unit of the County Counsel's Office. And I know, obviously, in the report, you know that, and by way of some additional context, I just want to mention that in Santa Clara County, we have the benefit of a standing order that allows the social worker to consent to ordinary medical and dental treatment for our foster youth. It's a fairly broad order, and we were asked by this committee to create an early consent form that covers the period of time really before the court is even involved in this process, and to allow for timely initial medical and dental exams. And that's especially important for when the youth first come into care, in particular that first 48 hours. So your request was very timely in that it was received close in time to when the issuance of legal authority that suggested the Child Welfare Agency should be moving in the direction of individual informed consent for those initial medical exams. So in collaboration with our health and hospital partners, including the medical professionals at the Spark Clinic, the form was created pretty quickly. It has been reviewed and approved by DFCS management as well as the Spark doctors that provide most of these initial medical exams. And it provides for not only medical assessments, but also treatment for those kids who, when they first come into protective custody. It's also intended to collect some specific health information about the child, which was done at the request of the Spark Clinic doctors, things about information about allergies and other medical conditions that might be important for the care providers to know right away. I'll let Jackie speak to sort of the time frame for implementation, but we're hoping to get it implemented very quickly. There's a work group meeting next week to begin discussions, or continue discussions, I should say, around how to most efficiently and effectively implement the early consent form. And I'm happy to answer any questions related to that part of it.
So you also asked us to report back on identifying a central point of contact. As you know, our providers sometimes have children come into their offices and they don't know who to call or who to talk to, and the social worker is often not at their desk, rightfully so, shouldn't be. And so we have identified some resources that we're working to put something together. I did follow up with our dental partners because that's where the need came from. Talked with RFQHCs just last week to get together about how we can better meet their needs. And we hope to have that implemented in the very near future as well, related to the authority of consent questions that come up in the field while the child is in their office. You also asked us to...
Becky, can I just stop you there? So really we're talking about, it sounds to me like a technological fix, like a mechanism for getting those records uploaded and a way for people to access them.
Yeah, so that's my next point. We're actually, you also asked us to explore that data portal. And
what was the last thing you were talking about? I thought it was the data portal. What were you referring to?
The medical and dental liaison. So they have a child that shows up and the caregiver does not bring the adequate paperwork to show that they have the authority to consent for the exam. And they can call us to say...
So you're saying just having someone who's available 24/7 to pick up the phone?
Well, it's typically not 24/7 because exams are typically done during business hours. So
Jackie, what I'm asking is one a human resource issue?
Yes.
So there's a central person, so they're not
Yes.
chasing down a bunch of different social workers. And the other is the electronic solution we looked at.
That's correct.
Okay, thank you.
And the electronic solution, we did explore having some of this information added into HealthLink to start with. And we met with the health and hospital system, and it looks like there may be a way that we can do it. I've learned that some of these records are being uploaded into HealthLink, but we need to explore further as to the resource needs and the technology and how we would operationalize it. Because because of the hospital purchase right now, it may take a little bit longer for us to get it rolling. So, but we hope that we can get an answer very quickly about the feasibility of it, and then draw out the timeline based on what our next steps need to be to operationalize that for all foster children that are Valley Health customers or patients.
So on both of these items, when will you know what the timeline for implementation will be?
So for the early consent form, I am hoping that we will know next week because we've formed a initial work group with Local 521. And depending on what happens with the work group and whatever challenges in terms of the impacts 521 identifies, in the initial discussions we've had with 521, it sounds like it's not going to be a big barrier. So we're hoping that the early consent form we can implement in April. With regards to the medical and dental information, that is in very early exploratory stages. So we need to still talk with the health and hospital medical records staff and the compliance officer to get an idea of whether it's possible, how long it'll take, and everything.
So let me just make a recommendation. Why don't we just leave this item on the agenda? Next meeting, bring them. Whoever's a decider in the process, whoever's got a resource we need, invite them to attend. And if we need to make calls to invite whoever that is, because if there's a lead at the hospital, I want to know who the lead is. I want them to come. If wherever we're stuck, and the reason I'm feeling urgent is that and I know this is something, Jackie, you've been really putting your muscle into. It's just that we've been talking about this for such a long time. These are some things I just want to get zipped up. They're not low-hanging fruit. I recognize that. They're like medium and challenging fruit, but we just got to get this done because we've got so many other things that we want to be able to focus on. So at our next meeting, let's do an update on where we are on these 3 programs, and if there's somebody we need to bring from Health and Hospital, bring them.
Okay.
Thank you. And thanks for all the work on this. Anything else you want to make sure we know?
No, I think that's it.
Great. Thank you. All right. So we're going to move on to item 11. Oh, I'm so sorry, Susan. I'm sorry. Come forward. I apologize for that. I actually meant to call on you first, so thank you for catching that.
This weekend is going to be the 13th anniversary of when Gloria Hania jumped off the San Antonio overpass. She was a worker for Oracle. She was paying for her children's medical care, and she lost her job. She had been in a divorce, highly contentious divorce, which it shouldn't be, but the lawyers that she picked were the ones that make them more contentious. And she was informed she was going to lose her job. She told a friend she couldn't afford to pay for her children. She was on supervised visitation, and she was ordered to pay part of their medical and dental. And she drove up to the San Antonio overpass, and she jumped onto Highway 101. Scott has been in here over and over again talking about supervised visits. Scott has to pay $50 an hour to see his daughter once a week, and he can no longer afford to pay that. Imagine your child being kept from you or being held for ransom because there's a court order that has been in existence for 3 years that requires you to pay $50 an hour for your child. I have investigated these supervised centers. Cindy, you donated $1 million or plus $1.5 million to try to help these centers. You didn't help. You put the money right in the hands of the abusers. Our children are suffering. Our community, we know how to be good moms and dads. We know how to pay for medical. And when there aren't moms and dads to pay for it, then we need the county to do it. But we need you to start listening to the moms and dads, not to the lawyers that are writing the reports. If you listened very carefully, she told you that she had a standing order. Do you even know what that means? Where is the standing order? Who has it? Why was it gotten? And why do we get a standing order for some kids in this county and not all of them? You got to start paying attention, and you got to stop feeding the lawyers and not listening to the moms.
Thank you, and thanks again for your report. We're going to move on. Sorry about that, Susan. We're going to move on to item 11, and this is our Neighborhood Safety Services Unit.
Good afternoon, Mariel Caballero, Deputy Director of the Probation Department. Our presentation will be somewhat brief. Just as a reminder, Charmaine Moran, our program manager, is on leave. And I did want to take this opportunity to introduce the newest member of our staff, Myra Mejia. She comes to us from the nonprofit world, many years of experience. She's our new senior management analyst, and that position, if you remember, has been vacant for over a year, so we're really excited to have her in that position provisionally for the moment. So just a quick update about the work that we've been doing. Community Champions Award ceremony and community highlights will be what we'll cover in this report. As the Neighborhood Safety in Action, it really focuses on relationship building, establishing trust with our communities, sustainability through neighborhood associations or organizations, leveraging resources that already exist within the community, as well as seeding great work, encouraging growth through leadership and action, and transparency and accountability. So a really wonderful event, and I want to highlight the work of Charmaine and our PCWs, Andrea Martinez, who's here, and also Ariana Orozco Lopez and our partners in Gilroy. We had a Community Champions Award ceremony on February 7th. Over 300 people attended. We honored 4 residents and 2 organizations, including Somos Mayfair and the promotoras from Somos Mayfair, as well as the Gilroy City Police Department. Wonderful, wonderful event. Just really highlighting the work that's been happening over the last 2 years in the community, and we hope to have this event again in 2 years. Took a lot of work, so not going to commit to doing it every year. Our community changemakers were 2 young people, one from East San Jose, Valentina Galdalmes, and she's a student at Overfelt High School, and Brian Alonzo Cortez from East Gilroy. Our community buildings who help build neighborhood cohesion and safety were Somos Mayfair, and specifically the promotoras who work and train our Valley Palms promotoras, and are helping them learn how to use their voice in community action. And then the Gilroy Police Department and the Gilroy Residents Nueva Vida group nominated the Gilroy Police Department because this year they hosted their first Spanish language police academy for residents, which was amazing. And the police department really has been participating in a lot of events at San Ysidro Park, and the relationship between the Gilroy Police Department and the community has grown tremendously this last year. And we wanted to highlight that work as a model of what can happen in community. And then our community champions were Rita Ibarra and Jorge Mendoza. So they were honored. They all received plaques and got to say a few words on behalf of the nominees. As a reminder, our violence prevention place-based strategies include community engagement and neighborhood action plans, leadership development and capacity building, health and wellness, academic and employment, and pro-social and mentoring activities. And I'll highlight in both communities just a few of the things that we did in the last quarter. So in East San Jose, the Valley Palms Unidos group changed their structure from a hierarchical structure where they had a president and a vice president to a horizontal structure. And in doing that, they also created a new vision, mission, and goals for 2019. And they started working on a participatory budgeting process and have been discussing with with VPM, who's the property management group, a way to share the use of the Family Resource Center so that when Project Access, who's our nonprofit provider in there, is not using it, the community can use it for other workshops and events. And similar shared use agreements exist with First Five and Somos Mayfair, and so we're taking those models and figuring out how we can use them in private resident communities. And then for leadership development and capacity, the VPU members actually mobilized extremely quickly to attend a city council meeting last month, possibly in February, to talk about $14 million that is coming into Valley Palms through the City of San Jose's housing department to do renovations. And they advocated on behalf of better lighting. They're going to get their soccer field finally, so a huge win. They went to, yeah, we're super excited. And they're actually, we had a conversation with the property management and the property owners, and that's the first project they're going to work on as soon as they start getting the money. So we expect to break ground in the next month or too on the soccer field. We had 16 Overfelt Youth Fellowship participants who are engaging in Joven Noble and developing service learning opportunities. And at our next quarterly report, we'll give you a little bit of information about what they're doing in the community. And then we also have expanded after-school and enrichment activities in Catherine Smith. And we launched art therapy programs at Valley Palms and FRC. And just this week, actually, mental health first aid launched for the promotoras. So we're doing some really great work in East San Jose, and I have to highlight our partner, Somos Mayfair Project Access, and particularly the work of our PCW, Andrea Martinez.
Great.
In Gilroy, also doing great work, Nueva Vida hosted their second annual Spirits Night, holiday gift distribution to over 600 youth in San Isidro Park. They participated, the Nueva Vida group, as I mentioned, participated in the first Spanish language community police academy, and 20 youth are engaged in NSU fellowship programming, Joven Noble service learning activities with Conexión to Community down in Gilroy. Also, our PCW Ariana has been hosting Spark Youth painting classes for 16 youth ages 8 to 17. And every week we get more kids coming to painting classes because they're really enjoying learning that art. We also had youth participate in the Gilroy Garlic 5K Fun Run, and we are supporting Glenview and Elliott Elementary Schools in music theater and dance programs. So just a little snapshot. There's obviously much more information in your report. And that's all I have. I'm ready for your questions.
Great. I'm going to go to the public, and then I'll go to the board. Susan, did you want to speak on this item?
I just want to say that was the best report I've ever heard in here. Thank you for your work. And as a Gilroy mom for many, many years, I know the Gilroy moms know how to get this done. Whether it was our kids or others, two of the children I heard mentioned in that report, my kids used to play Guitar Hero against their moms. We knew in Gilroy no one was going to give us the money to help us out. We had soccer fields. We played in parks. We helped in the classroom. We did what we needed to do. It is really time for you to get the middleman out of this process. You're collecting our tax dollars and you're failing our kids until you put programs in place that teach them the arts, that teach them sports, that teach them ethics, that give them a skill that they can have a job in. When they get into trouble, we need to look at, was that arising from a family situation that we can help with? Did they get into trouble and get in our criminal justice system and get on probation in a way that was something we can do something to help them have a better outcome in their life? And we have to start doing that. We have all the services. We have schools that are empty on the weekends where practices can take place. We have terrific nonprofit organizations. The Gilroy Recs Department that was started by Jay Baxka is one of the best in the entire state, and the Los Gatos Saratoga Recs Department that is tied to the school district is also one of a terrific program, and I used to give them a lot of advertising for their classes because people want their kids in those classes. They should be learning to swim. They should be learning how to do CPR. They should be learning how to take care of each other, and we should be raising boys to be good men and girls to be good women. And when we give them programs that do that, instead of just talking about the basic needs and the legal mandate or what we have to do in a dry political setting, we will succeed. Right now, you guys need to do that. You've been doing it wrong for too long. And the time you've been in charge, our kids have been failed. And we have to do better. Thank you.
So Dave, do you have any comments? I know the Neighborhood Safety Unit was your innovation, so I never want to pass up a opportunity to let you talk about it.
No, I appreciate the opportunity, but it was a good report. Thank you. And we've been staying on top of what's going on very closely. When I saw Enrique Flores from my staff get up and walk out at the end of the report a couple minutes ago, I knew that means it's a good report. So he's satisfied. But no, we have thorough notes coming in, and continue to encourage the implementation of mentors, as you hear from us, from my office, from me all the time. Obviously, that's picked up some real success in 95020 that we see here in the report. So thank you for that. Congratulations on the soccer field. I read through my notes that new council member Maya Esparza had a lot to do with getting that funding put together. She seems to be off to a pretty amazing start after a couple months. So we were just sitting here a couple days with her talking about funding a different project. So it's great to have good partners over at the city helping us out. Thank you.
Definitely. Thank you. She wrote a wonderful memo in support of all of the improvements at Valley Palms, and she's actually going and meeting with the Valley Palms Unidos group in a couple of weeks. So we're excited. And on March 30th, Councilmember Arenas is also celebrating the grand reopening of Welch Park.
Yeah.
So we'll be there doing a walking school bus.
Good. That's going to make a lot of heads turn. Dave, do you have anything else?
No, thank you. And I do want to say one thing is I heard about the Welch Park event from the council member in District 8. But as I mentioned before, if there's any kind of opportunity for an official visit out to Valley Palms, please let us know. I'm sure, I know my staff has been out there, by the way. I get that loud and clear. But it would be certainly fun to go out there with the council member, the new council member, and tour around at some point. If she's going to do that, let me know. And if my schedule allows it, I'll certainly come out. Thank you.
And I would just echo that because I haven't been out there and my staff has too, but I'd like to spend some time. I just have two issues. One, welcome to our new team, provisional or not. Welcome. Second thing is I want to ask a question about the Fair Pool that's out. Is Fair Pool in any of the zip codes that we're targeting for either through the Mayor's Gang Task Force or our own work? It's near Fair Middle School. Could you check? And let me just say why I'm asking. This actually goes to Councilmember Esparza. Asked us to think about an old partnership that we used to have with the city of San Jose, wherein they funded partially the pool being open, and we funded it for being open for things like swim lessons and lifeguard training. It was really focused on more low-income families being able to help teenagers on-ramp onto jobs. So it feels like it's connected to a whole bunch of our work. I told her, Mariela, I honestly could not remember the funding source, even though this echoed in my mind that the county used to invest. Could you help us track that down?
Absolutely,
Thank you.
Thank you.
That would be really helpful. And then on Gilroy, I just wanted to make mention, if housing comes up as an issue in the South County area, I would be interested in better understanding that as a topic. And here's the reason. As you may know, the City Council there did a moratorium on any new multifamily housing, which is unfortunate because there's some housing that really needs to be built, frankly, so some other housing could either be rehabbed or, rebuilt. But the City of Morgan Hill is really interested in a partnership that looks at housing, youth engagement, and a series of other issues that they've been trying to excite Gilroy into partnering with them. And I just wanted you to keep your ears to the ground to help us understand if you see an opportunity to have those conversations with the community. Then I will have them with everybody else. But I really am interested in what's bubbling up in your work.
We're actually partnering with a resident who is hoping to bring all the property managers together.
Great.
And our community worker, Ariana, is working to facilitate that. So I will make sure to put a bug in her ear to bring that information back to us so that we can share it with your team.
That would be great. And also with Key, because I want to get them in as early as possible.
Wonderful.
Perfect.
Thank you so much.
Thanks for your work. Okay, we're going to move on to item 12, and this is a verbal report from the Social Services Agency Fearless Leader.
So good afternoon. Just wanted to mention one quick thing, and that's around prevention retreat that we will be hosting at Social Services. This will be on April 2nd, and it will be taking place from 9 in the morning till 12:30 in the afternoon. And this is to really pick up where the Joint Foster Youth Task Force recommendations that have now been published have left off. And this is to put together an action plan around those recommendations, and also hopefully deepen the conversation around how to move the system also deeper into prevention efforts across the board, but also hopefully spark conversation around not just foster youth, but across all of our systems and do cross-system work around that. So it's an opportunity for folks to get together with county leadership, stakeholders, community members, and engage in this action planning for implementation effort. We have sent out a save the date on this, but we just wanted to mention it here just in case we happen to miss anyone. This will be a working meeting, and as such, we will set the room up to accommodate that, which means there'll be kind of limited ability on the attendance. So we definitely want to make sure we hear from everybody and we can set things up the right way and make sure the invites are out to everybody. We're looking really forward to it and very excited to take this next big step around implementation around the recommendations.
Very exciting. Susan, did you want to speak on his report? And I would just ask if you could, for these last two reports, to focus on the topic. So come on up.
Actually, I'm going to wait for 13.
Okay.
I have something more specific on
All right. Thank you. Ignacio?
Thank you very much. I have just one item for my report, and it's a legislative update. Assembly Bill 1091, which was introduced by Assemblymember Joan Sawyer, seeks to amend the Family Code Section 4007.5. What that references is what happens to an individual who owes child support when they become incarcerated. Our county is a member of the Child Support Directors Association. The association is putting together a letter to address some of the concerns associated with that legislative proposal in terms of ensuring that individuals who are incarcerated have ample opportunity when they're released to be able to secure employment before child support debt is accumulated and they're unable to pay the debt because of their incarceration. Often what happens is individuals are incarcerated, child support debt accumulates, they're unable to pay that debt, and then when they're released and working through reentry, they're trying to get on their feet and they're unable to because of the amount of debt that they have when they're coming out of being incarcerated. So our county and my work with our association has provided them feedback around some of those opportunities and some of the changes we'd like to see in some of these legislative proposals, this one in particular, to ensure that individuals have an opportunity to have more ample time once they're released to be able to secure employment before any child support debt continues to accrue. This is actually prior legislation that was scheduled to sunset, and that now is being reintroduced to make sure that it becomes permanent. So just wanted to give an update on that important piece of legislation.
Great, thank you. Susan?
You open the door to my roundhouse. So we have a situation in Dave and Cindy. You guys are aware when I sent you some settlement papers from Shir Hadash, that was a parent who had been involved in Persky's courtroom, and Jeff Rosen sent him to jail related to a child support issue. People need to understand that what is happening with child support, and a lot of it is complicity in our Department of Child Support Services, is that in these high asset divorce cases where the parents have a job or a business with a high-tech firm or something where they don't make traditional income, the judges will often do what we call a Smith-Ostler bonus. And they hire vocational examiners to get the other parent back to work, usually the mom, but sometimes the dad. And what's happening is we're putting so much effort on collecting, and it is a political buzzword. There's going to be a new legislation, too, about deadbeat parents, and are they going to publicize them on a list statewide and say these people aren't paying their child support. But what's interesting is in that law, the people who will be put on that list are the janitors who really were charged too much improperly because they didn't have a lawyer. It won't be the high executive people who get out of the Smith-Ostler. I had child support services case I opened when I was representing myself in court, and the judge was required to bring DCSS in, and she didn't do it. And DCSS told us, oh yeah, well, we know that lawyer on the other side, he does this all the time. I was imputed for income. My husband owes me over $100,000 in back child support. I've never been able to collect it. DCSS has never gone to go get it. I gave you papers today for Diana Dong. She also had a DCSS case. She was the one that told me to open a DCSS case. And she was imputed for $150,000 of income, was being threatened with contempt because she wasn't paying it. They make up money that you can make that you could never make, and then they try to incarcerate you for not doing it. This is happening to moms and dads, and it's not good for children.
Thank you, Susan. I want to just say thank you to everybody for today's meeting. We're going to adjourn, and we will reconvene Wednesday, April 17th, and we're going to retreat before that. So thank you, everyone.